am Dr. Chandorkar. I am practicing in Pune since the last 35 years as an adult interventional cardiologist. I would like to share my ideas about hypertension and why it is important for the general population to be aware of high blood pressure. We have all realized that in the last so many decades, more and more young people are becoming hypertensive. Hypertension used to be a problem of the aged, of people who are old. For example, there is a study which has been carried out amongst people who had normal blood pressure on their 55th birthday. If those people who had normal pressure at that time lived long enough, which is just another 20 years, which means they live up to 75, which is what pretty much most of us live up to or hope to live up to, almost 80 to 90% of these people go on to develop hypertension as a function of age. In that scenario, hypertension is truly something that is going to happen to all of us if we live long enough. What is therefore the normal level of blood pressure and why is it so important? The normal blood pressure for most adults throughout the world, irrespective of age, is 120 by 80 millimeters of mercury or less. The upper level of blood pressure is referred to as the systolic blood pressure, and the lower level is called the diastolic blood pressure. In young adults, it is more common to see mixed hypertension, which means your systolic is high as well as your diastolic is high. In an older person, however, it is more often seen that you get something called isolated systolic hypertension, which means only the upper pressure rises beyond the acceptable limits. Each poses different health risks. If you have mixed hypertension, there is a greater likelihood of organ damage. However, in the elderly, when you have isolated systolic hypertension, the greater risk is to the brain and to the heart. This is something that we need to understand. Most people think that hypertension has to have certain symptoms associated with it, which doesn't happen. Hypertension is referred to as a silent killer, basically because many a times, in fact I would say most times, people have no specific warning symptom. So you could be walking along the street feeling really top of the world without any symptoms whatsoever, and when you check your blood pressure in an annual checkup organized by your organization or in an insurance checkup or for whatever other reason, you are found to have high blood pressure. In that scenario, sometimes people have a difficulty in accepting that they have high blood pressure. If on multiple readings we do get high readings, it is better to initiate therapy. Now, therapy can be a lifestyle change. We need to exercise regularly, and exercise has a salutary action on lowering of blood pressure. We need to eat less salt, which means you cut down on the aerated drink usage, you cut down on consumption of alcohol, you cut down on the consumption of anything which comes out of a pack, which means your pre-processed foods will always contain greater amount of salt than home cooked food. So it is best to go in for home cooked food and avoid the salt rich items if you do have high blood pressure. Lose excess weight if you are overweight, and take an account of what is the current baseline situation, whether there is any organ damage, whether there are any comorbid conditions, which means concomitantly existing diseases like kidney disease or diabetes or high cholesterol, so that we are better able to reduce the risk to your health by tackling each of the factors which is abnormal. After having done that, if lifestyle changes do not lower the blood pressure enough, or if on the first visit the blood pressure is unacceptably very high, which means above say 170 systolic and above 105 diastolic, then I would definitely initiate drug therapy right away, even if all other reports are normal. If any of the reports are abnormal, then drug therapy will be initiated at a much lower level. The target is to get people down to 120 by 80 or thereabouts. In very elderly people, sometimes it is difficult to lower blood pressure without producing unpleasant side effects of the drugs which are required to be given. Why is it necessary to reduce blood pressure at all? Some people will say, doctor, I have no problems, I have no symptoms, my pressure is 180 by 110, so why do you want to give me drugs? Now there is a very interesting epidemiologic study, which means you observe a large number of people over a long period of time, and in that it has been shown that starting at the level of 110 by 75, if we have a rise of systolic blood pressure, which means the upper pressure, by 20 millimeters of mercury and the lower pressure by 10 millimeters of mercury, the risk of cardiovascular disease increases by a factor of 2, and this goes on as a continuum, which means the higher every rise of 20 millimeters systolic will increase your risk of disease by a factor of 2, so it doubles, and every rise of diastolic by 10 will also double the risk. So imagine if you are at 180 by 110, what is the risk like? So it has gone up by an insane amount, almost a factor of 20 times. And in that scenario, you would not want the risk to go up that much, and you don't want to suffer. You don't want to suffer a stroke, you don't want to get heart failure, don't want to get heart attacks, don't want to get kidney failure. So from that viewpoint, you want to stay healthy and live long. So we want to add life to years, not just years to life. So we want to improve your quality of life. Therefore, it is necessary, I feel, that young people, even as young as 30 or 35, should have regular checkup, not the kind of heavy packages which are marketed to you by the diagnostic companies, but at least a few basic tests, a good physical examination, so that non-communicable diseases like hypertension, which are essentially stemming out of an abnormal lifestyle that we are leading today, are spotted in time and treated in time, so that we reduce the risk of complications of the hypertension and a risk of your productive life. I hope all of you take cognizance of what I just said. Go monitor your blood pressure, spot your problems early, and get them treated if they happen to be present. Thank you so much.